board. So yeah, that's where I'm at. So sitting here in cold Colorado for now.
Mhm.
Yeah, yeah. So who are we missing? We're missing Elise is not here yet, and Debian is not here yet. Okay, but we'll get started. So welcome. Let's see, I need to make sure everybody's on camera. Camara, I'm looking at your wall. So if you could pull the camera down a little bit, there you go. Let's see. Lisa, I can't really see you. I'm looking at your ceiling. There you are. Thank you. Thanks for everybody coming in on time today. I appreciate it. We can get started earlier. Does anybody have any questions? Lara brought up a question earlier. She came in early just to clarify. She was wondering about all the different topics in NCLEX this week. Well, if you look at NCLEX this week, when you select pediatrics, what was the first one? I don't have it in front of me, Lara. The first concept was, well, let me take a look. Hang on. So there's a lot of NCLEX questions are going to cover a lot of concepts this week. All right, so I'm just looking in week 3 here for NCLEX. So when you go into NCLEX, some of you have already done it, but you select developmental stages. Well, it says it's going to cover infancy to adolescence. And then you select pediatrics, and there's a whole bunch of different topics that come up. You have to select eye, ear, infectious communicable diseases, integumentary, metabolic, endocrine, and then throat and respiratory. So based on those selections, you're going to get a wide variety of questions. All right. So it wasn't a typo. It just is covering a lot of different topics this week. Okay.
So that is
And
that
what,
I'm
oh,
sorry.
no, go ahead.
Is that in the topics? Is it in our assignment?
Yeah, let me show you. I'm going to share my screen. Whoop. Hang on a second. Let me share my screen. So if you go into your week 3 module, right? I'm in week 3. I'll get to week 3. And you pull up your NCLEX assignment right here, week 3, right? It's going to tell you what to select up in this box.
Okay.
All right. So you're select content under developmental, select infancy, adolescence, under pediatrics, select all these different ones. So make sure you're selecting these so you get the variety of questions that it's asking you. And that's why if you do one batch of 50, it's gonna pull all that together. But if you do like 2 25s or 5 10s, it's going to break it all up and you're not going to get the variety. And the reason there's so many topics in this particular NCLEX is we're covering these concepts, right? We're covering growth and development. We're covering childhood ailments. So does that help, Charmaine?
Yes.
Okay. And speaking of NCLEX, everybody that's turned in NCLEX so far has been in the 40s. So that's great. Remember, you can do your NCLEX as many times as you want, right? So if you go and do these 50 questions and you get in I've already said this in week 1, you get in the 30s. Don't submit that. You know, if you're working on it ahead of time, there's not a whole lot you can do if you're working on it Sunday night, an hour before it's due. But if you're working on it ahead of time, then you can go back and see what you got wrong, right? See what you got wrong, read the rationales, and then go in and retake it. And hopefully your grade bumps up. If it's still not what you want it to be, I always encourage students to submit NCLEXs between 45 and 50. That to me tells me that you have learned through this assignment. In the 30s, you haven't. Okay, so I've gotten 40s, all 40s have been submitted. And it's early enough where if you do submit me a 30, I'm probably going to send you a message back that says, I'm going to reopen the assignment for you if you'd like to try and do a higher grade, feel free to do that. Some students take advantage of it, some don't. I can't do that at the last minute on a Sunday night, but I can do it during the week if you're submitting your assignment during the week. And I see a 30 or 30 something. I can send it, reopen it for you. Does that make
Do
sense?
do you mind 2 sets of 25? Because some
I do.
teachers be like, they
No,
want
I
50.
need one set of 50.
Okay.
One set of 50, because then you're going to get a variety of all the topics you've selected.
All right.
It really messes things up when you do the two, like I said, the 225s or the 510s. You're just not getting the complete picture of questions.
Thank
Right?
you.
But take the time to do it. Take the time to read what you got wrong and learn from the rationale and then redo it. See if you can get a grade higher up. And these NCLEX assignments are really good assignments in preparation for future testing. They really are. Okay. Anybody have any question about that? I sent out a couple of important announcements in the last couple of days. I need everybody to go into ExamSoft. You'll be testing a week from today. Need everybody to go into ExamSoft and take that practice test. Okay, that practice test just re-emphasizes that your computer setup is correct, everything is connecting, so that we don't have any issues next Tuesday when you take the exam. All right, so
I know.
please go
I
in
was
and
having difficulty, like it was saying something about a code, but you're not the only teacher that was saying something about a practice test, and the code that they were given
okay, all
on
right.
campus wasn't working.
I thought that code automatically populates. I'll put that in an announcement. Just so you know, I'll tell you guys the code is Fortis 01.
Okay.
But I'll put that in an announcement. Capital FORTIS 01. It's a
Okay,
generic code for all those exams. So Fortis 01
So all
should
the
work in
practice.
all your classes.
Okay.
All right. So I'll thank you. I'll put that in an announcement. I thought it just automatically populated, but go in, who know? I mean, hopefully everything's fine from last term to this term with your software and compatibility and setup, but go in and just double check. Okay.
Yes.
And
Thank you.
then, does that help? Okay. And then, the other announcement I want to point out was the availability assignment availability. I don't know if anybody has seen that, but we had our faculty meeting yesterday, our monthly faculty meeting, and we have to be uniform across the board in all the classes. And so what we decided was that we were going to make the assignments available on the weekend prior to when they were due. So if you read the announcement, you'll see in this class, it only affected your 4 NCLEX assignments and your 2 case studies. All right. So I had to, if you go back and look at dates, I had to make that available on the Sunday before it was due. All right. So for your next NCLEX, okay, it would be available on that Sunday of week 6. So that goes with your 4 NCLEX assignments and your 2 case studies. The rest of the assignments I want to keep open because I want you to work on them. Your HESI prep and your vulnerable populations due in week 10, your HESI prep due in week 9, those are open now because I want you to be able to work on them. Okay. And I've kept the infectious disease group project open since day 1. So those 3 are totally open. Okay. Does that make sense? The rest of the assignments, the 4 NCLEX, 2 case studies are going to be available on Sunday of the week it was due. All right. Speaking of the infectious disease group project, today or tomorrow, I'll be sending out the announcement with the group assignments. I'll do my best to keep you in the same campuses so that if you're on campus, you can work together on campus. I'll do my best. Okay. And then if I said in week 1, that project is due in week 7. So it's open. You can look at it and what's going to be required of the group. Okay. So you'll be getting your groups in the next couple of days. And this is week 3. So you have 4 weeks to work on it. And the goal is for somebody in the group to take the lead, send out a group email to the group and say, hey, we're in the same group. Who wants to do what? And then everybody starts working on their section of what they want to work on. And then somebody will have to take the lead on getting all that information back and putting together the paper. That makes sense? So you'll have your groups in the next couple of days. Okay. What else? Hang on one second. Somebody just came in on iPhone. I don't know who that is.
That's me because I can't do anything on my computer. It keeps freezing up and it's making me miss half of what you're saying. So I'm trying to do it on my phone today. So
Oh,
I
is this
can actually
Lara?
read.
Oh,
Yeah,
yeah.
because I had major problems with Professor Luminosos this morning. I couldn't even talk or anything on
Okay.
there.
So Lara, when you have a minute, if you would change the iPhone and make sure it has your name in there.
Okay, how do I do that?
Oh, how do we do that? I think
Let
you
me
might
just-
have to go back out. Right? And it's your three dots on your phone and it says
No,
change name.
you don't have to do that. You're gonna
Okay.
click on participants. So when you click on participants, it should show 19 people. You're gonna click on that. You're gonna click on like iPhone with the quotations that says me. Once you click on it, you'll be able to edit your name. Put your first and last name.
Oh, perfect.
Real
Thank
easy.
you.
No problem.
Thank you. Thank you. Thank you. Appreciate that. Appreciate your help. Okay, does anybody have any questions about anything we've covered so far? So here's the way we're going to do things today. We're going to take quiz 2 now. Okay. Then we're going to go over quiz 2. And then we're going to cover, actually, when we go over quiz 2, we'll be covering a lot of content. So then we'll go back and we'll see what we missed in content. Okay, we'll cover that. Okay, and then we're going to break up. Thanks, Lara. I see it. Perfect. Thank you. And then we're going to break out into 3 breakout rooms and we're going to do the case study. The case study, it's a migrant and farm work case study, was in your week 3 announcement at the bottom, right below your weekly notes. Okay. So each of the 3 breakout rooms will answer one of there's 3 questions, and then we'll come back and talk about it. So it's just reinforcing the content learning. Okay. Anybody have any questions? So it is 1:14. So let's take 15 minutes and complete quiz 2. It's open. I opened it before class, so you should be ready to start. Make sure you submit it. You have to stay on camera while you're taking the quiz, and then we'll review it at 1:30. How's that sound?
Okay.
Okay. So go ahead and start working on that. I'll mute myself to get the background noise out. Looks like I have one student that I'm waiting up to finish. And if everybody could come back on camera. And make sure I can see your faces. There's a few faces that can only see foreheads. Debian, are you done with your quiz?
Yeah.
Have you submitted it?
Yep.
Okay, thanks. Okay, everybody's done, everybody's submitted. Debian and Kamira, I'm looking at your foreheads. If you could pull your cameras up so I could see your faces. Here we go. Thanks, Kamira. Debian, if you could pull the camera up a bit so I could see I'm looking at your wall behind you. Okay. Jay Laquan, if you could pull your camera down a little bit, I'm looking at your wall. Thank you. Okay, so how did you feel about this quiz? Did you feel better prepared?
Yes, I did.
Yes,
Yeah, I did way better this time, so I'm
I
not
did
mad.
too. I did
You
too.
all did way better this time. All of you did.
Oh, can you scratch the first one?
Well,
Horrible.
Right.
well, my assumption is that having your week 3 notes ahead of time, right? Because I sent them out after class last week. Having your week 3 notes ahead of time, doing your week 3 reading helped you prepare. And that's the goal. That's the goal of these quizzes, right? It's not a gotcha to do it at the beginning of class it's not a gotcha. It's to hopefully that you've prepared a bit for class. Because as you will notice, all your quiz questions came from either your readings or your notes, right?
A blueprint.
Oh, your blueprint notes, right?
I'm just having trouble understanding the class. Like I need to wrap my head around like with P's and like maternity, like you understood exactly what it is. Like I'm confused on what the class is really about. So I have to figure
Okay.
that out.
So I want you to stay on after class,
Okay.
and you and I are going to schedule a time to meet.
Okay.
Because we're going to get you on track now versus week 9.
Okay.
How's
Thank
that?
you.
You're
Yep.
welcome. You're
I'm-
welcome.
I'm with Maisha too, Professor Marvel.
Anybody else that wants to take advantage of that? I've met with lots of students this week already and last week. That's part of my role. I need to make sure that you can make that shift of hospital patient care to community patient care. And it is a big shift. It's a big shift. It's looking at things very, very differently, right? When you're in the hospital taking care of patients, I highly doubt you're thinking about the rural populations and the migrant farm workers, right?
Right.
Right. And so this is care in a community setting, which looks a heck of a lot different than your med-surg clinical assignment, right?
Yes.
It's making that shift, and it's hard. It's
is.
hard. It's hard to make that shift. But as I said in week one, think about your communities. Think about where you live right now. Think about all those populations in your community that potentially need healthcare, right? Whether it's the hospice patients, whether it's the people coming home from the hospital with a stroke, whether it's people going to doctor's appointments and medical office buildings, urgent care,
Oh.
correctional facilities. These are all, and so much more. These are all places that people need healthcare, potentially need
Like the
healthcare.
migrant farm workers, I didn't even know we had people who work
Exa-
in a farm and get paid that little bit of money and get exposed to all that. When I read that, I couldn't believe it. I've never heard of, I never knew that exists. So it's
Most of
like,
them are undocumented.
yeah, I didn't know nothing about it. When I read it, I said, wow, that's what's going on. I didn't even know we had that going on.
Let's
Yeah.
say, Maisha, you lived in a rural, let's say you lived in, I don't, you drove 60 miles away from your house.
Mhm.
You were just taking a joyride and you came upon a rural community that had agriculture. This is what's going on in that community.
Wow. Didn't know. Learned something new.
Yeah, well, that's the goal. Josephine, I cannot see you. I'm looking at something on your wall. There you are. Okay. All right. So let's review the quiz. I'm very proud of all of you. You all did much better. So yay. Kudos to you guys. And hopefully you learned something along the way. Well, I know Maisha
Yeah.
did,
Okay, I did.
right?
Professor
Sorry,
Marvel,
Josephine, I still can't see you. I'm looking at your wall. If you could just put the camera down on your face, that would be fantastic. There you go. Thanks. I appreciate it. All right, let's go through the quiz. I'm going to share my screen. You guys should be able to buzz through this quiz since y'all are all smarty pants today, which makes me happy.
I
What?
just want to say,
Oh.
on the first question, I am so upset with myself because I had it and I sat there for like 5 minutes going back and forth with that question. And
Uh-huh.
I had it right the whole time. It was just supposed to be the first one in the
Two.
very
Oh,
I
sorry.
put three,
Sorry.
two.
And you
And
Well-
changed your answer. You're not supposed to change your answer.
Okay. Okay, here comes my first test taking mantra. I have a couple. Okay? And I'm going to have to use Jay as a example since he just said it himself. He just said it. Okay? You do not change your answer until you can 100% convince yourself of why the original answer is wrong.
Mm.
Okay. It can't be, I think I heard her say that in lecture. I think I read that. Those thinking things are not good enough to change your answer. Okay. So
Hmm.
please do not change your answer unless you are,
what's wrong?
unless you can convince yourself you clicked the wrong button because your mouse was going too quick, whatever. Okay. That's number one. Number two, for all you overthinkers, okay, if the information, let me back up. All the information you need to answer the question is in the question. Okay? If the information is not in the question, it doesn't exist. So if you're trying to add all this stuff into the question because you're overthinking it, none of that makes a difference. In fact, it'll probably end up hurting you. Right? Whatever is in the question is all you need. That's it. Okay? Nobody's expecting you to say, well, what might have happened to their other family members? Well, do they have a history of that? Or, well, what might have been going on 6 months ago? No, if it's not in the question, don't add it in there with your own thoughts. It's just going to confuse you. That's my tip for overthinking. I share my tip for changing your answers. And here is another tip. And we might have done this on quiz one. if you get to a question, and there are several in this quiz, that it's not a select all that apply. Okay, but more than one answer looks like, that could be correct too. That one could be correct too. What do?
You pick the most severe one.
Before that, what do? You go back and reread the question to see what you missed. Okay, because if it's not a select all that apply, and there's more than one answer that might look correct, you missed something in the question. You missed some kind of word or cue or phrase. So maybe it said, what is the most important? What is the first thing you do? Well, then you can go back to your 2 answers or 3 answers that all look correct and say, all right, out of these 3, what's the most important? Because that's what the question is asking.
What gets me is like.
Does
the
that make
select-
sense?
Yeah. To select all that apply and they have like, which interventions.
Is
The
this one
F-
of the questions?
It was one of the questions.
All right, look, you know what? Bring this up when we get to the question.
Okay.
I want to go through it. Let's go through it. Okay. So, Jay, what did you change here? What did you think what'd you do in question number 1? Jay?
So I had the correct answers, but then I kept like battling against the employer provided insurance. But no, I don't know why I put that. I don't know
Okay.
why I put that. Because in the reading, it just literally touched on those 2 and nothing else.
Exactly. So think about what you learned about rural communities. Okay. Highly unlikely that they have insurance or they may be underinsured, but they're certainly not going to get the health insurance that provides health, medical, dental, whatever, vision, retirement, vacation days, right? Those are not the kind of jobs that are in rural communities. Okay, so most of them do not have
Manipulate.
employer provided insurance, right? And A and D are the correct answers, but let's talk about why B is not a correct answer. What did you learn about the rural communities? Do they have all this access to pediatricians and cardiologists and neurologists and specialty? No,
No,
they
'cause
don't.
I remember
Right?
you said they might have one doctor for the whole.
Maybe 3
Mhm.
counties.
Yeah.
Right. So think about if you are out, I think of rural as out there, and believe it, when we go to Wisconsin, we are out in a rural community. There is nothing out there. So I have the experience of living in a rural community. Okay. There isn't access. You're lucky if you go to the local public health department and the doors are open. Right? There's just not the access to the healthcare services. They may have one urgent care, but otherwise, if you need specialty care, you're traveling. Right? You're traveling to the nearest city or the nearest town that has those services. And what do we know about rural and migrant health? Since they don't have insurance, they're likely to have a daily or hourly paying job, right? And so for them to go travel 4 hours down to the cities to whatever, are they going to do that? Or, I mean, they'll do it in an emergency, but are they likely to travel 4 hours to have a primary care appointment? Probably not. They're going to miss the whole day of work, right? Which means they don't get paid.
In Bali, yeah, do that.
What?
Might find you a what down there?
I'm sorry?
I don't gotta pay for no rides, I don't gotta pay for no food,
Yep.
and I don't gotta pay for no registration.
Jay Laquan, I'm going to mute you, okay? With the background noise. Thanks. Okay, so that's question 1. So we know that they are much more likely to have environmental chemical exposures just for the location and what they do.
Mhm.
right? A lot of rural communities are agriculture. Okay? Most likely they'll have more complex chronic illness. That's correct. We just talked about that. They're going to have more chronic illness because they are much less focused on their primary and secondary care. They're much less likely to seek out preventative care. Right?
Can I tell you
then-
how oh, sorry.
No, go
Can
ahead.
I tell you how I got that question?
Yeah.
Is because the very sentence on the one about access to physicians, because honestly, the adequate access to physicians got me, but the words that got me knowing that they were wrong is the words most at the very beginning of the
Exactly.
sentence.
Good pickup. Exactly. Good pickup, Lara. Chronic illnesses, going back to that. Rural, you read in your readings. There's a lot of similarities between migrant farm workers and rural population. There's some differences, but there's a lot of similarities. So when we talk about rural communities having high percentages of complex chronic illnesses, that holds true for both populations, migrants and rural. They just don't prioritize their primary care, right? And they don't even prioritize secondary, which is screenings. Okay, so by the time you see these two populations in the urgent care, they're already way behind the 8 ball, right? Because they haven't sought out their primary or secondary. All right. Question 2. So the nurse is developing a tertiary prevention program for rural members of the community. Before we even answer this question, let's review. Primary is what? P stands for what?
Preventing,
Prevention. Preventing something before it even happens. Secondary, S, stands for what?
Screening.
Screening. We're trying to screen to find risk. Right? So we're doing blood pressure screenings to find people who have high blood pressure to start to treat them. Right? We're screening, we do mammograms. We do all these screening things to early identify risk. Okay, and what's tertiary? T.
Treatment.
Treatment. You have to have something. Either you've had an illness, you've had an injury, you had a diagnosis, you have a condition. You have to have something. So what's the right answer here?
educate families on.
Diabetes
Foot
related
care.
foot care.
Diabetic foot care, because what does that
Mhm.
imply?
Yeah, they have
They're-
diabetes.
They have diabetes.
Yep,
Okay, what about B? What's B?
That would be primary
primary.
Why?
because it's providing information to
Information.
educate for prevention.
Right,
Mhm.
exactly, exactly. What is C?
Secondary.
Secondary.
We're screening.
Mhm.
What's D?
Screening.
Screening,
Secondary.
right? So if we are doing routine pap smear screening, we are hopefully picking up on a risk, if there is one. If we're doing blood pressure screening, we're hopefully picking up on a risk. Early identification, early intervention. And there are primary, secondary, and tertiary questions on every exam, and there's several of them, so we have to understand that concept. Okay, so now the migrant farm worker presents to the outreach clinic complaining of abdominal pain, nausea, vomiting, diarrhea, skin rashes, eye irritation, throat, and difficulty concentrating. From your notes, what is that classic?
Chemical pesticide
Chemical
exposure.
exposure.
Right? Those are classic symptoms of pesticide exposure. And where's my blueprint? No, that's not what I want. In your, whoops, in your, I had too many things open in here. Week 3. I purposely highlighted this in your notes because you're going to get asked about this on the exam. You have to be able to, and that's why I did a quiz question about this. You have to recognize acute and chronic pesticide exposure, because one of the things we talk about with these populations especially the migrant farm workers, one of the biggest risks they have is pesticide exposure. So all that quiz question identified all these acute symptoms. Okay, so good for getting that right. I do want you to recognize chronic though. So let's say they've been working on the farms for 5 years, 3 years, whatever. Okay, that means they have been chronically exposed, correct? It's a
Correct.
whole different set of potential risks, acute and chronic. That's why it's highlighted. So with chronic, it's a chronic exposure. Birth defects, cancers, blood disorders, maybe neuro problems, maybe reproductive issues. Okay? So I want you to recognize that. Okay. All symptoms of acute exposure. Okay. So the correct answer was C, right? We want to ask them about pesticide exposure. We would definitely not be requesting a physician's order for an antihistamine because we're not even sure what's going on yet, right?
Mhm.
This is not classic symptoms of TB. Okay. And obviously this is a bit more than, again, conjunctivitis with all those symptoms in the question. Okay, during a home visit, the nurse notes that a migrant farm worker, I don't know why that's checked, is living in a small house with several family members. Which nursing assessment is a priority? This is a good example of a question where maybe another answer looks, there's more than one answer that look correct. So you got to go back to the question. What did you miss? Maybe you missed the word priority, right?
Yeah.
So what's the answer? What answers could be? Let's assume priority wasn't even in there. A could be correct.
B could be correct,
It
B could be correct.
and D.
And
D
D.
could be correct. So what do? We go back and say, what's the priority? Well, from our readings, and by the way, I'm assuming you did this since you all did well on the quiz. The 4 readings that are embedded into the module this week, there's no book reading this week. All your readings were embedded into the module, right? Addressing all 4 of these populations. Really good readings. In
And
fact,
videos.
yeah, when I developed my weekly notes, a lot of those, you probably saw in the notes, a lot of that is from the module reading. All right, so what do we learn about crowded housing?
That it can
What is
cause
that at risk
They are
for?
risk of
TB and hepatitis.
TB
tuberculosis,
and
TB.
gastroenteritis and
Yeah,
hepatitis.
yeah. High risk for TB,
TB.
right? So if the question is asking which is a priority, well, our priority is we're going to have to do a screening symptom questionnaire. See if that, B and D are okay, but they're not the priority. As we learned in our readings that overcrowded living conditions, sanitary issues present a few big risks, TB, GI, hepatitis, right? Remember that from your reading? Okay, now we're going to shift to poverty. Okay, which statement reflects the impact on income on health outcomes? Select all that apply.
low income.
We know,
Low income persons.
yep, we know that A is correct. Low income
B and C, B and D.
risks. A, B, and D.
B and D.
A, B, and D. Low income increases the risk of chronic illness. Think about it. Poverty in itself impacts so much. Okay. Not only does it impact chronic illness, it impacts access to healthcare. You learned about this in reading about poverty. It impacts access to healthcare, maybe access to quality education, access to preventative care, right? Low income increases the risk for all that. Low income reduces attendance to wellness visits. Yes, that's true. What if you're living in poverty and you have no transportation? What if you're living in poverty and have you prioritize other things such as wellness visits? So that's correct. C is obviously incorrect. And then low income does not improve health outcomes. That's true.
Mhm.
Right? Lot of risks with poverty. What should the nurse anticipate for a family living below the federally defined poverty line?
This one got me. This is the one that got me.
Okay. What did it get you?
It got me because of the word above.
The word,
In-
which word?
The word above.
Above.
Yeah. Because the
Okay.
question is, which should the nurse anticipate for a family living below the federal?
Below.
Yeah. So
Right.
when I read it, the answer, I'm like, not really. I thought it was, but I wasn't sure. And
Okay.
and I was just like doing the little word distinction thing.
Okay. So let's look at A. And again, I know we're taking a long time to go through this quiz. We're covering a lot of the content. Okay, that I was going to do afterwards. All right. So if you're living below the poverty line, you should be able to anticipate what kinds of issues there are going to be. A, poor health outcomes compared to those living above the poverty line. Right? Because those above the poverty line, it is assumed that they have more resources or they have access to getting, maybe they don't have the transportation barrier. Maybe they have access to better education. Right? B is incorrect because it says unchanged. Okay. But we know there are changes. We know there's a discrepancy, right? Of living below and above. So B is obviously wrong. Again, increased vulnerability to lack of employer provided insurance. If you're living below the poverty line, one of the things that's at risk too is employment or what kinds of jobs you have to work in. Okay. You're less likely to have employer provided insurance. So you have an increased vulnerability. And then increased vulnerability due to fewer community resources. If you're living in a community that has a high level of poverty, it probably also has a limited availability of resources. Correct?
Yes.
Okay. So A, C, and D. Number 7.
Oh,
Which
I got a question. I'm
Oh,
sorry.
Go,
So
go,
when
go.
it's 3 answers out of 1, it's 33 points for each one you got right? Rather 0.33.
It's set up to give you credit for answers you got correct.
But so if that's what I'm saying. So if it's 3 correct answers, 33 times 3, which would give you 99. So if you got 2 right, you should have 0.66 for the 2. And I got 2 right, and they only gave me 33. I got 2 out of the 3 right. You know what I'm saying as far as numbers? Like
Well,
it's
if three are, what did you get? 33?
Yeah, I missed 1. I only got 33. I
I
should have got the 2. You know what I'm
0.67.
saying? I should have got 0.66.
I got 0.67 because I didn't get the first one.
So you got 2 out of 3 is what you're saying?
Yes.
So she got 2 out of 3 and I didn't get that 67. I got 33.
And you have, I'll take a look at yours.
Okay. I need all the
This
points
is
I could get.
Question 6. You guys, stop. Stop it.
No, I'm joking.
Okay. I don't know why this one is correct. It's not the correct answer. Which client is at the highest risk? So again, a priority word in that question. Who is at the highest risk for
The baby.
adverse health outcomes related to
Baby.
poverty? The baby. Why?
Maybe.
15 years.
Because the children take precedence over anything else. That was
Okay.
what you said.
Okay,
There's no medical
that's
history.
one
So
reason.
one of them.
Children are the most vulnerable, but what else is going on with this baby?
There's no medical
Because they
history.
don't have any
There's no
history.
medical history.
Yeah.
We don't know about vaccination status. We don't know about any follow-up care since the baby's been born, if they've been identified to have any issues. So big question, big concern. Okay. Number 8, which would the school nurse expect from an impoverished adolescent? What's the right answer?
Literacy.
Increased risk of unintended pregnancy.
Correct.
Literacy.
Increased risk of unintended pregnancy. That's one of the very high risk factors for an impoverished adolescent. Actually, A is the opposite. There's an increased risk for dropping out of school,
Right.
right? B is the opposite. There's a decreased attendance to extracurricular activities. They're just not going to engage. And D is the opposite. They don't have good use of adaptive coping mechanisms. Right? Question 9. Who is, again, a priority word, who is at the highest risk for homelessness?
Veterans.
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 With, traumatic.
Okay, well, if you say that, then you could say mental health. You could say mental health and B, mental health and D, and substance abuse and D. So technically, they all have risks for homelessness. But what is it about the veteran
He's living alone.
Yeah, he's
living alone? So if something happens, who's going to be able to take that to the next step?
No one.
No
No
one.
No one.
Right? The older child is in therapy. The adult with schizophrenia lives in a group home. The adolescent with substance abuse has a supportive family. So the key there is living. Yes, it's a veteran, but they're living alone.
Mm.
Last question. Nurses working with the homeless population. What might she observe? Select all that apply.
All of them.
All of them are the correct answers. Did everybody get that one right?
No,
Yep.
I
Well,
didn't get the
Charmaine, which one didn't you pick?
mental illness.
I didn't pick mental illness either. I was like, it's a trick question. You can't be
Yeah,
all
I
of
was
them.
debating on. I wasn't sure.
Okay.
wasn't
Not
sure.
all of them. The one that didn't fit. If it ain't all of them is mental illness. All right, I'm not gonna go with that one.
All right. So 2 learning points here. There's a lot of select all that apply questions on the exams. Don't be afraid to select all.
Okay.
There's no rule of thumb. I know there's a belief out there. It can't all be right. Yes, they can. Yes, they can. Okay, so if you didn't answer mental illness, I mean, actually, substance abuse and mental illness are the
Together.
top 2
Mhm.
risk factors with the homeless population.
Absolutely.
And
right.
chronic
It is.
diseases are important. Yes, they do have them. Crowded, unsanitary. Yes,
Absolutely.
but mental illness and substance abuse they're way up there. They're 1 and 2. So
Mm,
going forward, Maisha, don't be afraid to select all that apply.
okay.
All right. Okay, let's see what we didn't cover in our content. Are you enjoying these weekly notes?
Yes.
Yeah.
Yes.
Okay, and really, it's not new information. It's not separate from the book, separate from lecture. Everything's connected. I've worked really hard in developing this class to make sure everything's connected for you, right? So the book is not separate from the notes. The notes are a summary of what your assignment was. Okay, so what do we know about migrant farm workers, right? Additionally to what we've already talked about, they're mobile, right? They're always moving around. Okay, so let's say they end up with a healthcare issue at one site, let's say they were diagnosed with hypertension, right? The chances of that information getting moved around with them are slim to none. So that's one of the risks they have, is their health information doesn't travel with them. They may be starting over. There may be a language barrier, and they may be afraid to seek out care, right? They're not going to be able to communicate with a healthcare provider or healthcare person, or nor are they going to understand what the discharge instructions are, if you will. Right? They don't understand what services are available to them. Talked about language barrier, transportation. They rarely have private vehicles to travel in. Female migrant workers, much higher risk of sexual harassment or abuse. The risks to kids in the migrant population are huge. Okay. Heat, cold, whatever, temperature exposure, pesticide exposure. They're always moving around. So lack of academic stability, lack of getting with a pediatrician if for well visits. It's not going to happen. Right? And a lot of migrants travel with their families. So that's putting young kids in the workplace, in the family setting, or in the farm setting. Okay, we talked about housing in one of the questions. A lot of issues. Housing is not available or it's substandard. Okay, so we need to be aware of that. We talked about this in one of the quiz questions. This contributes to risks of TB, GI issues, hepatitis. And then older housing. They're placed in older housing. We have that risk of lead exposure. Migrants are at high risk for chronic diseases. We talked about that. Diabetes, hypertension, stroke, poor dental, lots of dental issues, obesity, depression, mental health issues, substance abuse. Kids in particular, malnutrition, infectious diseases, dental issues, maybe inadequate immunizations, which puts them at a higher risk for contracting communicable or infectious diseases. Disruption of school due to constant mobility. We talked about that. Okay, please be able to know the difference between acute and a chronic. The question on the exam about this, be able to identify what we're talking about. Is this an acute exposure or chronic exposure? Rural populations. What do we think about rural? Remote, far away, doesn't have access to a lot of things. Maybe a small village, small town, as compared to a larger metro population. A lot of the same risks, right? Right here, less likely to prioritize their health care and engage in preventative activities, right? And even secondary activities for the screening, much more likely to smoke, have higher rates of alcohol abuse or substance abuse, obesity, less likely right here to engage in screenings. So with all the not prioritizing your primary and secondary, what are you going to get? You're going to get increase in chronic illnesses. The majority of the healthcare in rural populations, the majority is chronic illnesses. Okay. Tend to have poorer health, less likely to seek medical care. We went through that. Less likely to have employer-related insurance. Right? So when they do get sick, sometimes the distance is too long for them to travel. So they'll wait till they're really, really, really sick. And you get them in the tertiary stages, maybe lack of transportation, lack of services. They certainly have higher infant morbidity and mortality rates. Right? What if you have one physician and it's a family practice doctor and they don't have experience in OB? Let's say there's complications or risks. Okay. Rural areas lack pediatric or an obstetric specialist. We talked about mental health illnesses. Rural residents have a higher rate of persistent depression, at risk for stress-related conditions. There's a high unemployment rate in rural communities. Some of the more risky industries, when we talk about rural communities, forestry, mining, agriculture, marine-related fields, right? Much higher risk for machine accidents, vehicle accidents, trauma, cancer, allergies, respiratory issues, reproductive issues, birth issues, right? Let's see, we didn't cover with homeless and poverty. We talked about the poverty, the federal government establishing a poverty guideline, low poverty guideline threshold every year. Okay, what does poverty, what does the word poverty mean? It means poor. What does that mean? It's insufficient resources to meet 4 basic needs. Okay, right here: food, shelter, transportation, and healthcare. Those are your basic needs. Okay, what are some other contributing factors to poverty? Unemployment,
Mm-hmm.
maybe a 1-person household. Maybe you live in a community that's impoverished, has a high crime rate, high gang rate, high violence rate, overcrowded living conditions, not great schools, not great healthcare, not great grocery stores. Okay, poverty leads to many problems. Okay, and I'm here now. Poverty leads chronic stress, mental health issues, high rates of chronic illness, higher infant morbidity and mortality rates, shorter life expectancy, maybe higher disability rates, increase in hospitalizations. One of the things that, with regards to poverty and homelessness, it can often spiral into risk factors, so many risk factors, that you actually become homeless. Okay? Homelessness, let's talk about that for a minute. Homelessness doesn't mean people, just the people living on the streets. I saw a lot of this during COVID, was when I was in the schools. When people lost their jobs, they had to sell their house, they had to move in with family members, move into shelters. Homelessness is also considered for people that are living with family members, are living in shelters. There's no place for them to go after that. That's what's considered homelessness. Okay, the homeless population,
No,
lots of chronic health issues, lots of mental health issues, substance abuse issues. Everybody who's homeless got there for a different reason. Okay, one of the things that we need to think about if we're working with the homeless population is letting them tell their story, who they are, where they came from, how they got there. We can't be judgmental, right? We can't be not compassionate, right? That's where that therapeutic communication, trust comes in. Okay, and here's where it says the homeless includes those in the street, but also staying with friends and relatives, shelters. By staying, they just have nowhere to be discharged to. Okay, and here, nurse, it's vital we respect the individuality of every person. Many factors contribute to homelessness. And interestingly, many of us are 1 or 2 paychecks away from being able to maintain our own independence. So it's easy to be judgmental. It's easy to stereotype. And I always pose the question, you know, when you're out driving around or go to the grocery store doing errands and you see homeless people, homeless families on street corners begging for money. I mean, what do you think? What are your thoughts? You don't have to answer that out loud, but what do you think? What is your preconcept? What's your pre-thinking about homeless? So just think about that. Make no assumptions. Let them tell their story. Learn who they are, how they got there. It's difficult. It's difficult, but we all live in communities that have a homeless population, every one of us. Right? Here's a few examples of primary, secondary, and tertiary related to all the populations we covered today. So here's some examples. Primary. This was a question. Teach ways to avoid pesticide exposure. Preventative. Advocate for childhood immunizations. Preventative. Advocate for better living conditions for the migrant farm workers and rural community. Preventative. Secondary screening. So we'll screen for evidence of poverty, financial instability, screen for evidence of poverty, especially those with chronic health conditions. Can they afford their medications? Can they afford the resources that they're getting if there is a fee for those? Yearly blood pressure screenings, glucose screenings, educating on the importance of keeping those screenings, cancer screenings, pap smears, colonoscopies. Okay. And then tertiary. So they have something. So when we're in the tertiary level of education, provide guidance. Maybe we're providing guidance on medication. Okay, maybe we're helping a homeless client find resources. Maybe we're referring to the health department for somebody that has an STD or is positive for HIV. Teaching clients how to take their medication. Does that make sense? So those are some generic examples. Okay. So that's your week 3 content. We're going to jump. I'm going to put all of you in a breakout room. So somebody, if you're all on your computer, pull up that case study. Pull up that case study in the week 3 announcement, because you're going to have to answer either 1, 2, or 3, depending on your breakout room. Okay. Does anybody have any questions on content that we just went over? Helpful? Just reinforces everything, right? Right.
Is it the healthy people case study?
I'm just what?
Is it the
Nope.
healthy people
No,
case
I
study?
said the case study in your week 3
Okay.
assignment. Okay, and I've just assigned you all to breakout rooms. I'm opening them, so I want you to go in quickly. You only have one question to answer. We'll take a few minutes to do that, and then we'll come back and discuss what your questions are. So I'm going to open all the rooms. You have to join, and then you'll be with all your teammates. Okay, so somebody needs to have that case study pulled up. So if you're in room 1, you're answering question 1. If you're in room 2, you're answering question 2. If you're in room 3, you're answering question 3. Okay? So you're all going to get an invitation to join. Alyssa, you need to click on your invitation to join. You're the only one that's not joined. Do you have a question?
Yeah, we're not
Yeah,
sure. We having a hard time finding the case study that you're talking about.
Oh, Go into your week 3 announcement,
Mm-hmm.
all the way at the bottom. Under your
Mhm.
blueprint notes, it should say week 3 case study.
Oh, yeah.
Ooh,
You see it?
yeah. You said blueprint notes?
Yes.
Under that, there's a second attachment. It should say case study.
It's in the
Oh, video.
module?
It's in, somebody find the week 3 announcement,
Oh,
all the way at the bottom.
okay.
You see the second attachment is case study?
Yeah.
Okay.
I see
Here you
it.
go. Okay,
Thank you. Thank you.
you're welcome. Guys already have it figured out? Nobody's talking.
We already discussed it.
Oh, good. All right. I'm getting ready to close the breakout rooms here in a minute. I had another group that still couldn't find the case study, so
Okay.
see you in a bit.
Her.
How are you guys doing?
Fine.
Pretty good.
Did you find the case study?
Yeah, we're just trying to help someone
It's
find
on
it.
it's on the announcements. It's on week 3 announcement and information.
Okay, thank you.
Then it's
All right.
all the way at the bottom. It's like the
Okay.
first bullet.
All right, I'm gonna
Okay.
close these breakout rooms. We'll all come back to the main room. I have one group that's still struggling to find the case study, but it sounds like you guys are already done. All right, see you in a minute.
Okay.
So that one is to the very bottom.
Hey, girl.
Am I the girl? Hey, girl? Am I the girl?
I'm sorry. No, I'm talking to Christina.
Hey, girl. All right, so you're all coming back. So in order to try and maintain what I said I was going to do in week 1, which was to get you guys out, we have 5 minutes to go through these 3 questions. Okay, we're still waiting for others to come back. Because I promised with no break, you would be done at 30 after the hour. Did I not?
Yes.
Mhm.
I did. Okay, so let me share my screen. What am I trying to do here? I know what I'm trying to do. Okay, so let me share my screen here. Did you like going through that exercise? It just
that was pretty easy.
reinforces. That's what it's meant to do. Okay, breakout room 1. What was your answer?
C,
Why was it C?
because in a rural area, they're far away from a lot of the resources.
We just talked about that, right?
Yeah.
And there's your rationale, right? Think of this is intended to be you yourself working in the rural community as a community nurse, right?
Mm-hmm.
Professional isolation. There's nobody around, right? Your closest second opinion of bouncing something off somebody may be a phone call that's 4 hours away, right? Limited opportunities for continuing education. There's not a lot if you're the rural nurse. Lack of other kinds of healthcare personnel in your community. You may be it. right? Heavy workloads, everybody, ability to function well in several clinic areas. You're it. So you need all your PED skills and Jerry skills and med-surg skills and all that, you're it. It's not like you're working in a pediatric office or you're working in a assisted living for elderly, right? This is anybody in the rural community. And the one thing to mention too in the rural community that I forgot to mention is lack of anonymity. That is huge in the rural community. And it's one of the reasons why they won't seek out care, because everybody knows everything, right? They don't want everybody knowing their business. So let's say there's child abuse going on or domestic violence going on or substance abuse or whatever, mental health crisis. You're going to most likely see them in a crisis stage, right? Because they're not going to seek out, they're concerned about anonymity. In a small community, whether it's a farm, rural community, everybody knows everything, do they not? Okay, number 2, what's the answer? Pardon me?
D.
D. Yep, you're right. How'd you come up with D?
The language barrier?
Okay.
I thought.
Well,
Not even
it's
in-
knowing what the
Communication.
Mexican culture is about,
Future. Mhm.
right? Because most of our migrant farm workers are Mexican, are they not? So if
Yes.
we're working with this group, we're the nurse in that community, we better have a good understanding of that Mexican culture. And if you don't know it, what do?
Ask or find out.
Ask. You
Mhm.
ask. All right. So yes, the answer is D, and that's the rationale. And the whole rationale, I'm not going to read through it, but the whole rationale is about what the Mexican culture is about. Okay. And one of the key, let's say you have a communication barrier. Mexican clients appear to understand information by nodding. But a lot of times, if they don't understand what you're saying, they're still going to nod. Right? So you have to be able to find a way to come up and find a way to assess whether they're actually understanding you or not. Is it a language barrier? Do they not speak English? Okay. And group C, what's the answer for group C?
C, D, and E.
C,
D, and E.
C, D, and E. Think of the workload. Think of the question. They're working 12, 13 hours. One of the biggest risks is taking the toll. I'm in the rationale now. They're toll on the musculoskeletal system. Okay. Their exposure to chemicals, eye problems related to chemicals. And there's that skin cancer. Is skin cancer chronic or acute?
Chronic.
Right.
Right? It's a chronic, it's a risk for chronic exposure to pesticides. Okay? I think what I'll do is, since you only had the questions, just so you learn from it, I'm going to I'll send you the instructor part of it so that you have the rationales.
Okay.
If you want to go back through the case study and read through the rationales, how's that?
That's good. Thank you.
Okay. All right. All right. So I'm 1 minute over. I apologize. I'm trying to keep true to what I said I was going to do. Has this class today been helpful?
Yes, I just have
Yes.
one question.
So let me stop you from the question. If this question will benefit everybody, let's all stay on. If not, we can stay on after class and you can ask me the question. I'm trying to
It's about
respect.
the HESI prep assignment, so I guess
Okay,
it would cover
yeah.
everybody.
Okay, go ahead.
Did we finally go over one of the topics, which is vulnerable populations? But this one, it says homelessness, cold risk exposures, and we really didn't talk much about that.
Okay.
So
All right.
what would
So
we put down for that?
all right. So let me make a quick statement about the HESI prep. Every single box on the HESI prep is not going to be covered specifically in class. but the concept will be. So like today we covered homelessness. Okay, so yes, I mentioned that one of the risks for homeless is cold exposure. What does it say in the HESI prep?
It just says homelessness, cold exposure
Okay,
risks.
cold
that's it.
exposure. So now it's up to you to go back and research, what does cold exposure look like in the homeless? What might they present with? Frostbite, whatever. Does that
Yeah.
make sense? So
Yeah, I got
I'm
you.
not going to be going over every specific box, but I will be going over the concepts. And then it's up to you, right? So from what Lara just said, we know there's going to be a question on HESI about the risks of cold exposure to homeless. I don't know what the question's going to be, but it is going to be a question about that.
Mhm.
So if I didn't explain it in depth enough, it's up to you to go back and research. Does that make sense?
Yes.
Good question. Excellent, excellent question. Excellent. Does anybody have any more questions that will benefit the group? If not, stay on after for specific questions that you have. It was really nice to see everybody today. I hope you have a good rest of the week. Reach out to me if you need anything. Anything. And I mean that. Okay?
Thank you.
All right. Have a good rest of the week.
You too. Oh.